Hi all, I'm Dr. Neema Bhatt, consultant hematologist, BMT physician and pediatric oncologist. I am a hematologist who finished her undergraduate training in India, went abroad to the US, finished my residency and fellowship over there, got well trained to treat patients with blood disorders and pediatric cancers, and then moved back to India to apply the excellent techniques and skills that I acquired in the US. I practice currently with Therrapie, Hematology and Oncology, clinic and daycare centers. Today I'd like to talk about a topic: why hematologists are important in the community, who is a hematologist, and what are the types of disorders we treat. So most of you might not have heard of a hematologist. You would have heard of a nephrologist, you would have heard of a surgeon, a gynecologist. So who's a hematologist? Hematology is nothing but the study of blood. Hemat means blood and ology is the study. So study or a specialist of blood disorders and blood-related conditions is a hematologist. So we are vital for normal treatment of many conditions, including a lot of other doctors also require our help in maintaining or managing complicated blood-related disorders and complications. What are the conditions we treat? We treat everything that is abnormal in a complete blood count. So when you go to the doctor, your regular physician with, say, a fever or feeling tired or bleeding symptoms, any of these, they ask for a very simple blood test called complete blood count. So a complete blood count has hemoglobin, WBC, platelets, all these components in it. These are nothing but the type of cells that are there in our blood. And each of these cells plays a vital role in maintaining your normal homeostasis or normal functioning of your blood. So a hematologist would see you, say, if you have low hemoglobin that is not being treated appropriately, or the physician is not sure what exactly is causing the low hemoglobin, you'll be treated by a hematologist. You'll be evaluated and treated by a hematologist. You'll be treated by a hematologist if you have WBC count abnormalities. So whether the WBC count is high or low, we are the ones who evaluate or do blood tests and other tests to diagnose what is the reason. We also treat patients with low or high platelet counts. Apart from this, we treat blood cancers. So the three main types of blood cancers like leukemia, lymphoma, multiple myeloma. We treat other blood conditions called thalassemia, sickle cell anemia, aplastic anemia. We treat patients with autoimmune disorders. For example, rheumatoid arthritis, patients who have Aplar syndrome or lupus erythematosus, SLE or lupus as we call it. We treat patients who have problems with making clots in their blood. So anybody who has excessive bleeding, it can be nose bleeding, it can be excessive bleeding from the gums, excessive periods bleeding or menstrual bleeding, or bleeding in the, motions. So all of these increased bleeding disorders. Also the opposite end of the spectrum, which is excessive tendency to make clots, or we call it clotting disorders or thrombosis. We also treat these patients. Apart from this, there is a wide range of, treatment options or treatment we offer to patients who have cardiac issues, who are on blood thinners, patients who need to be evaluated for any sort of immune dysfunction where the immune system is attacking their own body, some other medical conditions like amyloidosis, and a variety of hereditary blood disorders or genetic diseases. If you need more information about how hematologist treats disorders and what exactly we do, I would encourage you to please reach out and contact Therrapie, which is a hematology oncology clinic, and you will be able to get more answers and to get your medical disorders that are hematology related appropriately addressed and treated. Thank you.